Hello, hi. This is Dr. Erica Onagbola with you once again. Thank you for joining me on today's chat. I'm going to speak about cold season, vaccines that are available, remedies that are available, and also over-the-counter medications such as vitamin C, ascorbic acid. There's also vitamins to help boost your immune system, products from Emergency, products from Robitussin, products from homeopathic um, manufacturers as well that support the use of non-pharmacological but actually supplemental medic uh, entities like homeopathic medications that only have natural extracted ingredients and not actual pharmacological. That includes the active ingredients that we're maybe used to. So there are some other alternatives that are over the counter as well, do not require prescription, but the pharmacist will be able to come out and help discuss any information you may require. Okay. And I just want to reiterate the use of vaccinations. There are three in particular: the influenza, which is one dose of a zero point 0.5 milliliters of vaccination, and that is once per season, once every 8 to 12 months, usually between the months of September, October to February is when you should get your one dose of influenza, zero point 0.5 milliliters per year for 8 to 12 months. And after receiving the actual vaccination, it takes about 2 weeks for it to actually build immunity against the flu virus of that season. So be mindful of that. So between the actual injection and the 2 week period for it to actually kick in and work, there is a time frame where the influenza, whether it be H1N1, H1N2, there's a 2 week time frame to where those viruses can replicate and cause flu-like symptoms or the flu itself. So be mindful of that 2 week time frame. Also, the second most important vaccine that we are aware of now because of the pandemic is the COVID-19 vaccine, which could be the Moderna, or it could be the Pfizer. So just be mindful of that. And that is usually a two-part dosing series to be given 4 weeks to 6 weeks apart during the COVID pandemic, but now it's from the CDC.gov. We know now that the vaccine is giving out regularly with the boosters. So if you have not already been vaccinated with the COVID-19 vaccine, it is very important to go ahead and do so. Okay, and then there's also a period between the injection time and the time that the vaccine actually kicks in and begins to work. So we know that the COVID-19 vaccine can actually, between that time frame, cause the COVID like symptoms, which is similar to the flu symptoms, but that still have that same particular uh, 2 to 4 week kick-in period. Okay, so the third vaccination that I want to make mention of is the pneumonia vaccine. Pneumonia vaccine can be given at any time to pediatrics as well as adults and geriatrics as well, healthy and individuals, as well as patients who have a behavioral habit of tobacco use, or a patient who has emphysema, or a patient who has a lung disease, or patients who've had a history of some sort of lung dysfunctions such as COPD. We know that those particular patients do require a vaccination of the pneumonia vaccine. And that is like a two-part series. Every 5 years, the Pneumovax vaccination, which is one of the two that are available. The Pneumovax vaccination should be given every 5 years, okay, after a certain age. And then the Prevnar pneumonia vaccine is the second type of pneumonia vaccine, and it should be given 2 years. The first dose should be given 2 years apart from the Pneumovax vaccination. And please consult your local pharmacist to make sure that you're age appropriate and that you qualify to actually receive that particular Prevnar vaccination. Okay, and it's usually covered by your healthcare provider. Check with your healthcare provider as well to find out about cost up front before actually attempting to receive these vaccinations. I am also interested in letting you know that vitamin C or ascorbic acid is also available, and it is available over the counter. It provides the vitamin C that you would get from a cup of orange juice or a cup of lemon juice, or a blend of lemon juice and orange juice together can help once a day, help boost your immune system to fight off against diseases and infection that are known in the cold season. Okay, and also I wanted to make mention there are other immune system boosters such as zinc. Zinc is also an immune system booster to help fight against symptoms that you may already feel during that particular uh, cold season. So zinc and vitamin C will help fight off the symptoms of the cold or the influenza as well. Hot soups, natural remedies, honeys, teas um, can also help boost the blood flow and help get the immune system boost and help to help you feel warm and more and more in tune to feeling better, and having breakfast and in the mornings can also help one feel better throughout the day during the cold season. Exercise is also good. It's also recommended 30 minutes of exercise 3 to 4 times or 4 to 5 times per week of moderate intense exercise to get your heart rate up to 70 to 80% of its max load. And then that can help to get your blood flowing, help get flexibility going, and help to reduce chances of being immobile or being bedridden or anything like that. So do make sure exercise is also incorporated into your cold season activities, whether it be inside or outside or indoors or outdoors. Something such as brisk walk or a warm swim, could be yard work. Again, it could be something that helps to get your heart rate 70 to 80% of its load. Okay, so also remember, besides exercise, besides vitamins and immunizations and being up to date on those things, make sure that let's make sure that we are also being mindful of our medications that we're already taking, such as our daily prescription medications, our other multi vitamins and minerals that we're taking. Let's make sure that we are on board with those as well and keeping up to date, and to help protect ourselves from comorbid conditions and falling ill even further. If we do, let's not think that we will, but if we do fall ill to influenza or COVID, we'll already be protected. Our other disease states will already be protected because we are on board with our other medications that we take regularly on a daily basis. If there's any other vaccines, such as the Zostavax, which is for shingles, for patients who are 50 years of age and older, do be mindful to request a dose of that, and also the cost of those from your healthcare provider. So that's all I wanted to make mention of on this particular video chat. Just make sure that we are on board with all of our vaccinations, and let's be mindful of any um, any any other vaccines that are out there, hepatitis vaccines, um, even also vaccines to help um, against our living quarters. If you live in a dormitory or you live in close quarters, there's vaccinations to help protect against certain disease states and infections that have arisen. And also, we want to be certain to make sure that we are taking good care of our own cells, being hydrated during this particular cold season. That's another point, being hydrated, keeping our skin moisturized, not chapped or dried out, but actually drinking um, appropriate water amounts per day. Okay, and watching our weights as well. Now, if you have certain heart conditions, certain lung conditions, drinking ample amounts of water may not be specifically for you, but do be mindful otherwise that being hydrated, fluid intake is a great way to stay healthy and fight off diseases and infections. That is, our skin is our first defense against such diseases, and so staying hydrated will help our skin to stay um, uh, defensive against such. So we do want to be mindful of that as well. So with that being said, I will sign off, and if there's anything I can help you with, please let me know. Thank you for joining me. I am Dr. Erica Onegbola, PharmD, and I appreciate you participating on this live chat. Have a great day.